Hello, how are you? When welcome. Welcome back if you've been on this journey with me from the very beginning, with me sharing my own personal uterine health journey. And welcome if you are new to the channel. I hope that you find everything on here very informational and very encouraging about all things uterine health. So I want to start the top of the video off like I like to do, is saying thank you. Thank you for your viewership. Thank you for your viewership, liking, subscribing, commenting, all the things to bring engagement towards this channel. So hopefully the algorithm can push it out even further. So thank you for joining me on today. I always let you know that my disclaimer is I am not a medical doctor. I'm a uterine health advocate, and the full description or disclaimer is in the description below. So I also want to share, and just as a reminder, that I provide topics on this channel regarding uterine health to provide information that hopefully sparks you if something resonates with you, for you to do a deeper dive into your own research. Maybe there's something that resonates with you that you can share with your family and with your friends. It's my purpose to take away all the stigma and the fear of not talking about, all the things and concerns and just natural conversations regarding our womb. And more importantly, or one of the most important things is, I hope this brings about a way that you can develop a healing plan with you and your doctor by asking better questions and, letting them know you're just as informed as well. So that is my purpose in providing you with these videos. So uterine health, let's talk about it. So today I am going to speak on uterine tract infection, commonly known or better known as UTIs. And you might be asking, what does it have to do if you're diagnosed with a UTI? What does it have to do with uterine health? That's a great question. I ask myself the very same thing. So before I get into it, I'm going to explain what a UTI is and some of the symptoms and the treatments that they offer. And I just went online and did a quick, overall internet search. I compacted into this lovely video, and I'm sharing it here with you today. So a UTI is a urinary tract, not with a T, not with a K, but a T, tract infection. So urinary tract infection, UTI, is a bacterial infection that affects the part of your urinary system that includes your kidneys, your bladder, or your urethra. So it's a bacteria infection. So now we know that part, that affects any part of your urinary system, which is, urinary system, just so you'll know, is where they, when you pee, essentially. Okay. So some of the symptoms you might face or you might experience if you are suspected of having a UTI is a strong, persistent urge to urinate, pee. You might have a burning sensation when you are urinating or peeing. You pass frequent small amounts of urine. Your urine appears cloudy, red, or have a strong smell. And the last one they have here is you can have pelvic pain, feeling of pressure in the lower body. So some of those are some of your symptoms of it that you could, an indication that you might have a UTI. So best to go to your doctor if you feel like you have any of those, just to be sure. So I just wanted to give you a note of how it spreads and becomes a UTI. So while most UTIs is limited to your bladder and your urethra, it can become a more serious infection and travel up to your kidneys and become a kidney infection. So that could be something like if you're having upper and back pain, high fevers and chills, nausea and vomiting. So this bacteria can really cause something serious to happen. And I just wanted to put that note in there too. So if you ever bypass the other ones, if you have these other ones, upper back pain, high fever and chills, nausea and vomiting, it might be an indication that you might have a urinary tract infection. So you might be thinking, like I was at one point, where exactly is the urethra on your body as a female? So I just want to explain it in case people don't know. The shape down there is pretty much like this. And so you have your clitoris, you have your urethra, you have your vagina opening, and you have your anal opening. And they're kind of all stacked right there between it. And between your vagina opening and your anal opening is usually not that much space for women. So, so that is where your urethra is. It's the very top, and that is where you urinate from. And that is considered the lower urinary tract, because I like to look at it, think of it as it's the last stop as it's going, things are happening in your body before you have to pee. So, or urinate. So that's where your urethra is. So, one of the causes for UTI is when bacteria, and they say that bacteria is often E. coli, travels from the digestive tract and enters the urethra and multiply. So it travels from the digestive tract, the bacteria, and it enters the urethra and multiplies. And doctors typically treat UTIs through usually test for UTIs through urine tests, and then they treat them through antibiotics, and UTIs are totally treatable. So you might still be saying, okay, what does that have to do with urinary health? Well, it goes through the urethra, so I'm going to get into it, right? Women are common. It is common for women to get UTIs. They say many women will have more than one throughout their lifetime of UTIs, being diagnosed with a UTI. And like I said, they're pretty treatable. Your doctor provides you with an antibiotic, and I think within like a couple of 5-7 days, the UTI should be cleared up. So, because women primarily get the UTIs because the urethras are short, it's all that. It's all that. It's the clitoris, it's the urethra, it's the vagina open, it's anal. It's all of that is kind of compact in there, and so it's very close to the anus and the vagina openings. And this allows bacteria to be able to, which is they say the E. coli, to commonly move from the digestive tract and easily travel to the bladder. So to make it plain, it can easily leave your rectal area, your anal area, your butt area, and travel through the urethra up to your bladder. So that's how we get it more often than men do, because men can have UTIs too, I found out. So, and you might be wondering still, okay, but what does this have to do with urinary health? I think I'm showing you about how it gets to the urethra. That's how it's affecting your urinary health. But I'm going to give you some more information just in case. So there's some common triggers so that for bacteria to be able to travel from the rectum area to the urethra. So one way is sexual activities. Intercourse can push bacteria toward or into the urethra. So whatever you're participating in, whatever you're doing, whatever you're sharing, it can get to your urethra and it can cause you a UTI. Wiping and your hygiene. So for those that do wiping from the back, from your anal opening to the front where your urethra is, can cause the bacteria to travel directly into the urine, to the urethra opening. So if you are a wiper that goes this way, then you are potentially exposing yourself to UTIs. But they tell you to, when you are wiping, for those that wipe, when you are wiping, they tell you to go from the front to the back, because that way you don't allow yourself to be susceptible to having a UTI. So any of the bacteria that's in the anal part is not, when you swipe this way from the top to the bottom, it's not getting into the urethra. So that's a way to protect yourself. So how you wipe. The other way is birth controls. Using diaphragms and other types of birth control can cause some vaginal irritation, and it make it harder for your bladder to empty, which opens you up for the potential chance of getting a UTI. Menopause, the dropping level of estrogen levels after, when you start your menopause, your estrogen levels drop, and that make it a urinary traction more susceptible to you. I'm chuckling because I'm just like, my goodness, we get into our 50s and 60s and we still can't escape stuff, right? And they also talk about low fluid intake. So, the lack of drinking water, because they're saying that when you have fluids in your system, it helps wash out the bladder and ridding it of bacteria and nutrients that help the bacteria grow. So when you're not drinking a lot of water, you're not helping your system flush out, the bad bacteria. What you're doing is you're creating a nice space for the bacteria to grow because, it's not being flushed out and clean. And so I didn't bring the string, but I saw a doctor talk about the thong, the panties, the thong panties. I saw a doctor talk about that. I thought I had a little string here, but I don't. So the doctor was saying, and just in case you don't, I don't have a string here. Just in case you don't know what the thong is, it's a panty, and the front part is shaped in like a triangle, and that's to cover your pelvic bone area. And then there is a string that goes around for your hips, and the other string sits at the tip of the triangle, which sits closer to your, probably closer to your clitoris. And that string goes from there all the way up to your backside. So literally the string is in between your butt cheeks and probably the lips of your vagina and things of that area. What she said that I never thought about was she wasn't against you wearing thongs, she said, for recreational purposes. But when you're wearing your thongs in your everyday life, the moisture, from maybe the vagina or whatever, as you're going out through your day, that string is moving back and forth. So any kind of bacteria that may be resting or sitting in the rectum area can easily slide up to your urethra and get into your bladder and kidneys and could potentially cause you to get a UTI. Who knew? So those are some of the things of how it affects us as, our uterine health, right? Our sexual activity, the way we wipe and our hygiene, birth control, menopause, low fluid intake, and the thong padding, right? And you still may say, well, how does that really affect me as a woman in uterine health if you still need more information? I'm really glad with your persistency about these questions because that's just how I was. So I'm just going to give you a couple of things that really show you how else, in addition to everything I provided to you, how a UTI really affects our urinary uterine health, and why we really shouldn't ignore it. Okay. So while UTIs doesn't directly affect the uterus, but the reproductive system and the urinary system are physically adjacent next to each other. So infections that affect the urinary system, because they are adjacent, could automatically or sometimes affect the reproductive system within your body, and it could cause inflammation and lead to uterine adhesions or complications during pregnancy. And I like to think about the adjacent to. I think if your house is adjacent to your neighbor's house, if your neighbor's house, we pray it never happens, catches on fire, because you guys are adjacent, you have the potential of those embers and those flames coming onto your house and now causing you a problem because you guys are adjacent to each other. Or if you think about when you're in traffic and you're driving along, and although they have those lines for you to stay in your lane, sometimes people may swerve, which cause you to swerve, which could cause an accident because you guys are adjacent to each other. So I kind of hope that helps you. That's what helped my mind when I'm thinking about stuff. So here are 3 more examples of how, UTIs affect your uterine health and affect us as women. So you might have fertility goals, right? And, if a UTI is severe and left untreated or tied to any sexual transmitted infections, bacteria can spread to the reproductive organs. And this can cause, like I said, the pelvic or the uterine adhesions that may interfere with embryo implantation, or it can restrict the movement of the eggs. So if you're trying to get pregnant and fertility is your goals, that you having a UTI that is severe and left untreated, it can prevent the sperm and the egg getting together. Another thing is if you are pregnant, this is a bacteria. If you've discovered that you have a UTI or symptoms of a UTI while you're pregnant, you need to speak to the doctor immediately and take care of this because you're growing a fetus, inside of you. And so this could potentially, increase your risk of preterm labor and low infant birth rate. So UTIs are very serious for your uterine health, right? And you got to think about it this way too. We learned in June that the uterus expands to make room for the baby. And as it's expanding, because these two are so, adjacent to each other, it's pressing down on the bladder and the urinary tract. So it and also could raise the risk of a UTI as the baby is growing inside of you. And the last way that it affects your uterine health is because during your menstrual cycles, if you are progesterone dominant, that can suppress your immune system and lead you susceptible to a UTI. So there's different ways that, UTIs are really affecting us in our bodies and our uterine health. So I just also wanted to throw this in there. This is period. Uh, I was just flabbergasted by it, and I thought I just should just share it with you, right? I talked about the dangers if you leave it untreated and how it can affect your fertility goals, right? Well, if you leave your UTIs untreated, it can lead to death, which I was very shocked about it because, again, this is something that is very treatable. And I couldn't believe it. I was just like, wow. So, what happens is the bacteria can spread to your kidneys or your bloodstream. And then you go into what is called urosepsis, which, is your body overwhelming and life threatening response to an infection. So, your body's trying to respond to this infection that is now seeming to take over his body, and it's called urosepsis. So when the bacteria enters the bloodstream, it can trigger a whole lot of things from inflammation to damaged tissues. You can have a drop in blood pressure that can rapidly lead to septic shock, organ failure, if not treated as a medical emergency. So again, this is something, UTIs are something very, I don't want to say simple, but they're very treatable. You get antibiotic from your doctor within 5 to 7 days. This is something that's cleared up. So if you have any of the symptoms and you want to do a deeper research on it, I highly recommend it. And you can see how this may or may not be affecting your life. But I just thought I would share how dangerous it is, for something that's totally treatable that can lead to septic shock, which could lead to death, which is, yeah, I was flabbergasted, just to be honest with you. So again, I'm providing information here so we can see how so many different things affect our uterine health that I would have never thought of. And I'm very glad to be doing this research and continually learning about things that affect our uterine health, even if they are adjacent to the reproductive system, right? So I do have 4 articles of reference for you to, hopefully do your own research and go down a rabbit hole if you need to. So, and these will all be listed in the description. So the first reference is from the Mayo Clinic, an article written September 2025. It's called the urinary tract infection, and it goes very detailed of what what it is. And then the second one is from the Medical Associates of North Texas, the dangers of ignoring a uterine tract infection. The third one is from the Library of Medicine, uterine tract infection in pregnancy. And the last one is from the Symptoms Alliance, and that's from September 2021, when the urinary tract infection turned deadly. So, not trying to scare anybody or anything like that, just trying to, again, bring awareness so that you will know that if you have symptoms of a urinary tract infection, that, not to take it lightly. Please don't ignore it. Go get it checked out from your doctor. And like I said, most times they can give you an antibiotic and it works. If your antibody is not working, then you need to go back to your doctor. I always say that, please go to your doctors, find out what's going on. It's better to know than not know. So I hope this information about UTIs and our uterine health was very helpful to you. And I will see you in the next video. Until then, take care of yourself. If you're not feeling well, please go get yourself checked out immediately. Take off your Superwoman coat, cape, and put it down and take care of yourself. Until next time, have a great day.